Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from Oklahoma City, Oklahoma, at the Free Market Medical Association annual conference, their 10th annual conference. And we're super excited to be a part of it, a sponsor of it, and just engaging with all the attendees and networking. A little history about the Free Market Medical Association. It was founded by Jay Kempton and Keith Smith. And Keith Smith is the Dr. Keith Smith from the Surgery Center of Oklahoma, which he started a cash-only surgery center, meaning he doesn't take insurance. And he did that 25 years ago or so. And we've been following him ever since. And we've toured the facility. And he actually wrote one of the quotes on my book, on the cover of my book. My book is called Sickened: How the Government Ruined Healthcare and How to Fix It. And the first thing I want to ask Janet is, Janet, what's the most important thing that you took away from this conference?
Well, one of the most exciting things about this conference is it was sold out. There was over 500 attendees, and 80, I believe, were students, medical students. So teaching young physicians how to practice affordable medicine, I think, in this country is a huge step, and we congratulate the organization for bringing all those students on board. In particular, Mr. Jack Brown worked really hard, as well as their local chapters, to get these medical students here to teach them how to be transparent in healthcare. It's really not a hard process, but people are afraid of it just partly because they're not used to having the free market in healthcare, especially when it becomes between their doctor and patient. And the exciting news about that is when we learn from the ground up, then it's not so hard to be transparent and not hide behind, the complication. Well, this is complicated. We can't give you a fee. Well, that's totally not true, because even in the Surgical Center of Oklahoma, Dr. Smith has worked really hard on transparency. So if you needed a knee surgery or a hip surgery, it's all inclusive. You can go to their site and look at what the fee would be, and then you don't have any big surprises or big gouging bills that you didn't even realize that would be coming up from behind. And I think that's one thing that's very exciting, because I think in the middle of healthcare, a lot of times we become a little emotional about maybe a situation, and we rely on other people who may not always have our best interest at heart. We're at this conference, we're really pointing towards how a physician can work with their clients to be transparent, as well as offer great one-on-one healthcare. And really, it's exciting because this is really something I believe doctors want to do. It's just that they don't always have the tools to get to that place in their career.
And when she says transparent, she basically means transparent pricing.
Right.
Now, there's a lot of other things that get hidden in healthcare too, unfortunately, but this podcast is not going to be discussing that. But think about it. When you go to a hospital and they ask, well, how much is a knee? You ask how much a knee surgery is. They don't know. They say, well, it's complicated. Well, that is the most ridiculous thing I've ever heard of. It's not that complicated. And I know anybody that's a surgeon out, some people that are surgeons out there or like to hide behind non-transparent pricing like hospitals. They're going to say that I don't know what I'm talking about. And it is complicated. But I tell them this, a new car is a pretty complicated piece of machinery, but you know exactly what you're paying for when you pay for it. So don't let hospitals or big clinics get away with saying they don't know what the price is going to be because it's complicated, because they definitely should. So, but Janet, you talked about affordable healthcare. Affordable healthcare, insurance is what makes healthcare affordable, right?
Not really. Actually, I think the third-party payer system actually keeps the client away from the honest transaction of a fee-for-service situation. And that's one thing that was really exciting about this conference is many of the doctors that are successful at giving care, whether even it was like Kathy Brown talking about her dermatology experience of having fee-for-service, which is, a specialty. And there's some that aren't lending themselves quite the same, but we had a podiatrist. She spoke about how she does her transparency with her clients, and also just direct family care. And these doctors work together with other people within the healthcare industry to bring affordable labs, imaging, surgical options. And so once we get this back, I think, in the free market, and we put the patient in front instead of a third party, actually the prices go down and the quality goes up.
Now wait a minute, Janet. Healthcare is expensive. You people paying cash for healthcare, that's ridiculous. Only rich people can pay cash for healthcare, right?
Not true. And many of the doctors that we talk to have different fee levels, but a lot of times, maybe, for example, the spouse is $80. The additional people might, like the wife might be $50, and then the children might be 15 or 25, up to maybe a maximum, depending on where they live. But it gives.
Wait a minute. So that's a day?
No, a month.
A month.
A month.
You can get access to a doctor for $80 a month?
Yes, you can.
24/7 access?
Yes, you can.
Really?
Yep.
Do I have to wait in line for 3 hours to get an appointment? Can I get an appointment same day?
Usually you can.
And can I do telehealth visits? Can they text me information over their phone?
Most have that access and that service available. And here's the funny part about it is most of the time it turns into more wellness situations, and you're not having to access because you do have access to somebody, rather than putting off some situation that could have been treated in an earlier visit.
Yeah, it is incredible. It's amazing how affordable healthcare is when you pay directly yourself. I think one of the most interesting analogies that I heard comes from Dr. Marty McCary, who was a keynote speaker, and he's also the author of The Price We Pay. He also put out a new book. We'll be discussing that. He's actually going to be on our podcast, so stay tuned for that. But he talked about the difference between, he had an insurance card in one hand and a credit card in one hand. And he asked the audience, which one would you get the better price? Of course, this audience is a biased audience. They already know the answer. But most people would say that, with the credit card, you're going to get you're going to pay a lot more with the credit card than you would with the insurance card. And that's just absolutely not true. Usually in the free market, the prices are 8 to 10 times less than insurance-based pricing. Let me give you a personal example. During COVID, in May of 2020, my youngest son, Jordan, broke his leg, compound fracture, had to go to a local hospital. It wouldn't have been my main choice to go. I would have went to the Surgery Center of Oklahoma if I could have, but it was a trauma. We needed to take care of him right away. So the hospital, all the bills after they came, all these surprise bills and non-transparent pricing, they had no idea what it was going to be. It was $48,000. I communicated with Dr. Keith Smith at Surgery Center of Oklahoma, and I said, what would the surgery have been there? $8,000. Okay, so let's just think about this. So, and the quality would have been better, and the service would have been better, guaranteed. Not that Jordan's surgery didn't go well, but the service he had in the hospital, he had to stay overnight and all this bunch of crap, which wasn't necessary. Surgery Center of Oklahoma, he would have been out much faster, would have recovered much faster. Although he recovered fast anyway. But so price at the hospital, $48,000. Price at Surgery Center of Oklahoma, $8,000. Let's just do the math there. $48,000. Let's say you have private insurance. Most people have a deductible. Usually I think the average deductible now is almost $10,000. So you would have had to pay that out of pocket anyway. Or let's just say you pay 20%. What's 20% of $48,000? That's almost $10,000. You would have been better off to go to the Surgery Center of Oklahoma and pay cash. You would have had better quality and better service. And by the way, if there's complications, let's say the hardware comes out, 2 weeks later, guess what? Surgery Center of Oklahoma, they don't recharge you like they do at the hospitals. They, where they do another surgery and they charge your insurance again. No, that's not the way it works. And in most industries, that's not the way it works. Think about what you would do with your car. If your mechanic fixed your car and a week later the same problem came up, if they're a good mechanic, they would fix it again for free, right? Well, that's how healthcare should work, but that's not how it works. They complication after complication, they just keep recharging you. Only in healthcare do they get away with the things that like that. Why? Because somebody else is paying the bill. If the consumer was paying the direct bill, pricing would be better, service and quality would be better because it would be demanded. But people wash their hands of their own responsibility and just think that, their insurance, that's just the way the system works. Well, stop thinking that's the way the system works. And stop thinking that you have to have employer-sponsored insurance. I'm not an employee, but I would not want an employer telling me what kind of healthcare I can have. And no employee should. If you think that's a good benefit, it's slavery. Employer-sponsored health insurance is slavery. They use it to control people. How many people have a job they absolutely hate? And they say, well, I can't leave. I've got too good healthcare benefits and I can't afford to leave. You know what? Healthcare is not expensive if you pay yourself. And for catastrophic things like my son's surgery, $48,000. We have Christian Health Share, Christian Ministries, chmministries.org. Go look it up. And we ended up paying zero out of pocket. They sent us a check within 7 days for the entire amount of his surgery after I negotiated the price with the hospital. Amazing. No way would an insurance company do that. So there are ways around that. I believe that traditional health insurance is a scam. It's a ripoff. And just think, if you think that you have private insurance, it's not private. If you have traditional health insurance like Premier Blue Cross, United, something like that, bought by your employer, it's government insurance. Because the government, the federal government, through Obamacare, tells the insurance company what to pay for at what price. So if you want to be controlled by your employer and you want to be controlled by the federal government, then keep your traditional health insurance. If not, you should be liberated and do something where you can pay and you can decide what doctor you go to, what hospital you go to, what services you access. Other than that, there are options, and that's one of the things that we talk about, Janet.
Well, I think for employees, if your employer offers some plan like a health savings plan, I think that's the place that we should go, I think, as employees, because that gives the autonomy back to you. So if they do have something, ask for a health savings plan so you can access who you want. And really, that's really important because, we could give you numerous examples, but even in the Northwest, we do have Veritas that opened up, and I believe in Moscow, that offers surgical answers to patients, and there's many direct primary care physicians in the Spokane and Idaho area, Hayden, even in Moses Lake and Wenatchee. So they are around in even our local communities. But the powerful thing here is when they pulled up a map as to in the state of Oklahoma, what's happened, and I believe this is a direct result of the free market working, is that there are so many people in surrounding states as well as the state of Oklahoma that have private practicing physicians that have a private pay, direct pay between the patient and themselves. And they work out their differences together without an insurance company interfering with the type of therapy that they may need or may not need.
And speaking of that, if you are going to a traditional doctor that takes your insurance, they don't work for you. They work for the insurance company, period. And the insurance company tells them exactly what you get, whether it be medication, whether it be surgery, whether it be imaging. The doctor is controlled by the insurance company, and that's who they work for because that's who pays them. So if you want to get the best care and you want to dictate that along with your doctor, then the only way to do that is pay directly without your insurance. Otherwise, the insurance company is controlling your health care. I personally don't like being controlled by anybody or anything. I definitely wouldn't want an employer or an insurance company dictating my health.
I agree with that statement. And I also agree with the fact that in this scenario, the physician themselves are actually, or nurse practitioners or PAs, are actually happier. I think, that was one of the exciting things about this conference too, is that the providers that are offering these services are enjoying their career. So when you go to them, you don't have somebody who's burnt out. You actually have somebody who is excited to help you. And that is important because I think that makes a big difference as to whether or not you receive the best service or not.
Well, and speaking of that, I have never met a direct pay doctor that is unhappy. They left traditional medicine typically because they'd been practicing it for a while and they absolutely despised it. And I haven't met one that is not happy. And I'll tell you this too. I have not met one doctor that practices an insurance-based model and likes what they do. I talk about it in my book, Sickened, How the Government Ruined Healthcare and How to Fix It. Doctor burnout is real. And doctors don't burn out because they don't like taking care of patients. They burn out because they hate the insurance model. And insurance companies tell them what to do, how long they can see a patient, what drugs they can prescribe, what surgeries they can perform. They have lost complete control, but they can get control back if they go to a direct pay model. They have a choice. And the best way to take care of patients is in a direct pay model. Like with any other industry, consumers will drive price, value, costs, quality, and service. And like with any other industry, healthcare should be no different than any other industry. And I know some people out there will say, well, without healthcare, people will die. Well, without food, people will die too. But that doesn't mean the employer should buy people's food. I mean, would you want, as an employee, would you want your employer buying your food and picking out your food for you? I mean, I think most people say no, because guess what kind of food you would get? Would you get prime rib and steak? Absolutely not. You get the cheapest food that they could buy. That's what they do with healthcare. Period. They pay for the cheapest thing they can do. It's not the best for their employees, or it's the best for the employer, and then they create a slave out of their employees because they're scared they can't live without healthcare. I want to say one of the things that's nice to see is that Janet and I, we started Mosley Professional Pharmacy 25 plus years ago in 1998. It'll be 6 years this October 5th. And in 2002, we started dropping insurances right away because we realized what a scam it was. Not only was it not good financially for us as a business, but it was not good for our patients either because they were dictating what people could get and what kind of service they could get. So in 2002, we dropped our last insurance. So at Mosley Professional Pharmacy, we have not billed insurance since 2002. So for almost 22 years. We were called crazy 22 years ago by family members, by friends, by employees that worked for us. They said, this is not going to work. You guys are going to go bankrupt in a year. And 22 years later, it's such an honor and a privilege to be a pioneer in this movement. Now you're seeing a lot more free market pharmacies and physicians. And in the meantime, the ones, our colleagues in pharmacies that didn't make changes, they went bankrupt, going in debt, further and further in debt, getting bigger and bigger credit lines, trying to chase insurance dollars. And just Google local pharmacies closing. Look at how many local pharmacies are closing. And we did not want to be part of that statistic. The reason they're closing is because reimbursements from insurance companies is so bad. But I can tell you, I don't really feel sorry for them. They should have saw this coming and they should have done something different. And that's what we did 22 years ago. And we are thankful for that decision because it's allowed us to stay in business and do what we love. And that's taking care of people, educating and empowering them to take charge of their own health. What do you have to say about that, Janet?
I just have to say that was the best, I think, decision. Otherwise, I would not be a pharmacist today because there's no way I could stay in that traditional setting of just adding to the chaos that's around us. And Keith Smith has a comment about, basically you're an accessory to the crime if you stay in the system. And sometimes you really have to look in the mirror and decide what part of this do you want to play or not play. And I'm glad we chose to just step out of the whole picture.
Yeah, we did not want to. We made a decision 20 some years ago that we either change what we're doing drastically or we get out of pharmacy because it was that bad. And if you talk to most pharmacists that work in traditional settings, they absolutely despise it. It's horrible working conditions, and it's because they have no autonomy. They're told what to do by insurance companies all day long. And most pharmacists have basically become glorified copay collectors for insurance companies and dispensers of poisons for big pharma. And we didn't want to be that statistic. We wanted to actually help our patients the best that we could with our knowledge and our wisdom. So, our goal at Mosaic Professional Pharmacy and the goal of this podcast, Health Solutions, is to educate and empower individuals to take charge of their own health. And that includes financially, because if they take charge of their own health financially, then they're going to get better health care. Period. And just remember this. This is a quote in my book, chapter 6. A lot of people know the healthcare system is ruined and they think it's broken, but they don't have a fix. Well, I have a fix in my book. That's what makes it different. You can get my book on Amazon. I have a 6-step solution. And in chapter 6, the 6-step solution, first of all, I open the chapter with saying that the best in health insurance we have, it's not some kind of policy we can buy. Don't let the media, don't let the government, don't let this narrative say that you got to have this great health insurance policy, that costs $2,000 a month or whatever. The best health insurance we have, it's right here. It's how we take care of ourselves. It's how we eat. It's how we sleep. It's how we move and exercise and take care of ourselves. There is no better health insurance than that. You cannot buy your way out of a health insurance. You cannot buy your way out of bad health by buying a health insurance policy. Yeah. You can't do it. It's absolutely impossible. And I want to say how much money you can save as an individual if you don't have traditional health insurance. We have a health stream ministry, Christian Healthcare. I discussed that with my son's broken leg. We pay $180 a month. Yes, you heard that right. $180 a month for both of us. Okay. And a traditional health plan would probably be about $2,000 a month. So we save $20,000 a year because we don't have traditional health insurance. I mean, think about that. My brother did a post on Facebook the other day. He has the same thing that we do. And he has saved in his family over the last 12 years, $250,000. Think about that. That's $250,000. He gets to spend that money where he wants to spend that money. It's unbelievable how people have been brainwashed to think that they need this, Cadillac plan of health insurance. And by the way, if you're not paying for it, you say, well, my employer pays for it. Okay, well, it comes directly out of your wages. I mean, if I was an employee, what I would do is I would go to my employer and say, you know what, you can keep your garbage health insurance. How about you give me an extra $1,000 a month and I'll pay for my own health care. And you would be way better off. And that's what needs to happen is employees need to start going to their employers and saying, I don't want your health insurance. I want to do my own thing. You give me the extra money. Janet?
I agree with that. I think being in the buyer's seat is always going to give people direct access to control because otherwise you're just a bystander and you're on the train just for the ride. It doesn't mean exactly how that's going to work out for you or your family members. And so I think having access to those funds yourself, whether it would be a health savings account situation or whether you just purchase it, like a ministry like Shawn and I. And there's some out there that aren't faith-based that are popping up all over the place, and they do a wonderful job as well. So there's options available. And I think in the long term, as we are moving forward, it's exciting to see even just the progress that we've made with the Free Market Medical Association as to how this movement is moving across the United States. And taking back this industry, I think, is really crucial to the success of our country too, because also having control over your own body is a huge freedom issue right now. And we faced that in the last few years where somebody else was dictating how we were supposed to take care of our bodies.
Yeah. You don't want a health insurance company or an employer taking care of your health. Like I gave the example of the food. You don't want to buy in your food. Why would you want to buy in your healthcare? Seriously, because you're not going to get the best food. You're not going to get the best healthcare. So the last point I want to make before we wrap this podcast up is just like the title of my book says, Sickened: How the Government Ruined Healthcare and How to Fix It. So I think most people would believe that, our healthcare system is broken. Now, I will say this, the parallel system I'm talking about, the free market system, it's thriving and well. I love it because that's what happens in capitalism. That's what happens in free markets. So I do believe that, our traditional health insurance-based system is broken, but the free market system is thriving and well, and you have options. So that's first and foremost. Second of all, I believe what I say with the title of my book, the government ruined it. Most people would realize all the government regulations and all the government payment systems, Medicare, Medicaid, Veterans Administration, things like that. Most people would agree that those are not the best way to get healthcare. They ration healthcare. They tell people what they can and can't have. Anybody that's had a sick parent or grandparent on Medicare realizes this. And 75+% of all healthcare in the United States is covered by some government entity. So if you believe that, and you believe that the government makes things worse with healthcare, then that also means that more government intervention is not going to make it better. It will only make it worse. So if you're thinking about a one-payer system, my guess is a one-payer system would be closer to Medicare for all. I personally, I despise Medicare. I think it's a Ponzi scheme. I think it's unconstitutional. It's not good healthcare. The government has no business being in healthcare. It's bad. I don't ever want it. Unfortunately, in our communist country, the way this healthcare system works, you can't opt out of it. I wish I could opt out of it. I'd love to have my tax money back and just opt out of it. But probably what a one-payer system would look like would be Medicare for all. So any healthcare professional that's listening right now, or any person that knows anything about Medicare because they've accessed it, they know how bad Medicare is. So why would it be better if everybody had Medicare? That's the last comment I would like to make in today's podcast. Anything else, Janet? While we wrap this up?
No, I just want to say that, coming to a conference like this is always uplifting to us, because it's nice to see how a market really does progress when it's fed in the transparent way. And even connecting with several practitioners and watching how their practice has grown and they're thriving. So even if you weren't somebody that felt confident enough to open your own practice, there's many of these physicians, and they would probably gladly take you on as a partner or even just an employee, because their doors are full. Their doors are full. Like they are receiving so many clients that, they are looking for other people to partner with them.
That's
and
right.
So what a good problem to have, but they're thriving. And that's so exciting, because I know at the bottom of this, anybody that has went into healthcare did so to actually help people. And I feel like the joy of being able to do that is displayed with your interactions with these physicians, and they're super excited, and they should be, because they're doing what they were called to do in their life. They have a purpose and they're actually living it. So that's super exciting for me. And I always leave this feeling empowered because of what we have witnessed.
So we mentioned the Surgery Center of Oklahoma. I wanted to stream their website here and just talk really quickly about it. So, when these hospitals tell you that, that pricing isn't transparent because it's too complicated, check out Surgery Center of Oklahoma. And check out, you can, here's their price, find an ankle procedure, Achilles repair. There it is, $6,561.
Right.
By the way, and that's all, it's that easy. It is that easy. Achilles repair is that easy. And here's the thing is that this is all inclusive. There's not going to be any surprise bills. This includes anesthesia. This includes, any supplies. This includes, the doctor's fee, all that kind of stuff. It's all inclusive. So there's not going to be any surprise later. So if anybody is looking for an elective procedure, shoulder surgery, hip surgery, and they're worried about, pricing and if their insurance is going to cover it or whatever, Surgery Center of Oklahoma. There's also Veritas Surgery in Moscow. We interviewed them a couple weeks ago, and their model is based off Surgery Center of Oklahoma. So Moscow, Idaho. Transparent, no surprises, better quality, better pricing, better service. And then the last thing I want to talk about is we are doing our own little free market convention. And one of the things that we are doing is we like to teach people how to, and specifically healthcare professionals, how to get out of the system. Because one of the fixes is not just patients paying cash for services, but healthcare providers that are trained to accept cash services. Because call your average doctor that takes insurance and ask them, what's the price to see you for a basic wellness visit? We don't know. We just bill your insurance and they tell us what to pay, what to charge. What? I mean, seriously, that's crazy. And do the same thing with a pharmacy. Call up your local Walgreens pharmacy, ask them, what's the price of XYZ drug for a 30-day supply? What insurance do you have? Well, I just want a cash price. Well, we usually bill your insurance. They tell us what to charge. That's ridiculous. So most all healthcare providers hate being in an insurance-based system. You don't have to be an insurance-based system. We are hosting Medical Freedom Northwest this next coming weekend in Spokane, April 20th, and we still have a few seats left. Go to the Moses Lake Professional Pharmacy website and you can register there. And you can also meet Dr. Mary Bowden, who is speaking, and she just recently beat the FDA, which is a huge win. Basically, the FDA had to stop playing doctor. The FDA cannot tell doctors what drugs they can prescribe for what disease. It was a big win. You can get to meet her, even if you're not a healthcare professional. If you would like to come to our VIP reception after the event, you can do that for $99 and meet and hang out with some of the pioneers in this industry, including Dr. Scott Jensen, who's from Minnesota and was one of the first ones to expose some of the misaligned payment systems that was going on during COVID and how people were profiting from it. So you don't want to miss out on that. April 20th in Spokane, we're going to be at the Centennial, the Davenport Centennial. So there's that, and that pretty much wraps up our podcast. Stay tuned for our regularly scheduled podcast Monday, 12:30 to 1:30 Pacific Standard Time. I have no idea who our guest is, but it's going to be a great one. And I thank all of you for watching and following us. If you have any questions about the event, please comment. We stream live on YouTube, Twitter, LinkedIn, Facebook. Message us on any of those platforms, and we will get back to you if you need more information about the event. So thank you for listening to Health Solutions with Shawn and Janet Needham. Tune in Monday, 12:30 to 1:30 Pacific Standard Time for our regular scheduled podcast. Thank you so much.